All right, good Thursday afternoon. Welcome into Fox Weather Philly. I'm meteorologist Scott Williams. It's the hottest day of the year. Another day of record-breaking temperatures in the 90s. This is too soon. I mean, we're talking about numbers that should be in the mid-60s this time of year, but yesterday was 91 degrees. Today, temperatures going into the low 90s, so back-to-back records, smashing records, in fact. And with all of this heat, the pollen has really been exploding. And joining us today on Fox Weather Philly Live, we have our friend Dr. Segal, an allergist here in the Delaware Valley, to talk a little bit about the impact of all of this pollen. Thanks so much for joining us. It is that time of year again, my friend, and I know you're probably seeing a lot of people coming to your office with problems. So what's going on right now?
I mean, as the temperatures have warmed up, these warm, windy spring days are ideal for high pollen counts.
Oh, yeah, absolutely. I mean, it's through the roof. I mean, it seemed like we were never going to come out of the doldrums of winter. I mean, we had all of those snowstorms. We had that blizzard in February. We had all
Yeah.
that snow that just seemed like it wasn't going to go away in January as well. And now we're finally in the heat. It seems like be careful what you ask for, right? Because with all of the warmth, we're seeing just that pollen exploding right now. So I'm sure it's impacting a lot of folks. It's rare to get temperatures back to back in the 90s for the month
Sure.
of April. So, I mean, I'm sure you're starting to see a lot of folks being impacted by just this explosion, this onset of pollen. It just seems like it's stronger than normal.
Yeah, I think as that sharp warm up from really, really cold temperatures to warm temperatures is gonna release, if nothing. I mean, explosion is probably a good way to describe that pollen bomb that people are feeling, and I think they're really feeling it. I mean, friends and family are calling, complaining of their itchy eyes, sneezing, congestion. Even people who don't typically experience allergy symptoms at these very, very high pollen counts, they're going to be symptomatic as well.
Yeah, I mean, it's just insane to think that, temperatures are supposed to be in the 60s for this time of year. And we're talking about numbers right now. As we take a look at the map here, Philadelphia is checking in at 90 degrees. It's 91 in Doylestown, 91 in Reading, 91 in Hamilton. Now, it has been a little cooler down the shore thanks to that colder water temperature as well as that sea breeze. But I mean, you can literally see that pollen coating the cars, the
Yeah.
vehicles. I've been paying attention as I've been coming into work. And yesterday's record was 91 degrees. That broke an old record of 88 back in 1941. The forecast today will likely hit 92 degrees, and we are certainly close to it. So as we take a look at the forecast, Dr. Segal, you can see what we're looking at over the next several days. Really not a lot of relief in sight. Now, there will be a
No.
little chance for some rainfall as we get towards your Sunday, but the air has kind of been stagnating across the Delaware Valley. Now, we have had that wind. It's been blowing and distributing that pollen, but I mean,
Correct.
a lot of concerns out there for some of the allergy sufferers. Any advice on what we should be doing to try to prevent some of the suffering that's going on right now? Is it too late?
Well, there are a couple key things to remember. So, warm, windy, sunny days like we're experiencing now are when pollen counts are going to be highest. Those we can look forward to those rainy days that'll give us a break where pollen counts will come down. If there were things that we could do, maybe we could adjust our schedule or our activities based on the weather and the time of day. Pollen counts are going to be highest first thing in the morning and early in the afternoon. They tend to be lower later in the afternoon and in the early evening. So if you're going to do outdoor activities, you could time things that way. Wearing sunglasses, those really, really high pollen counts are going to irritate all of our eyes, our nasal passages. So wearing eyeglasses or sunglasses will help keep the pollen off our eyes. Masks, we don't want to go back to that, but they actually play a protective role for those people who are particularly sensitive to high pollen counts,
Mm-hmm.
especially our patients with asthma. When you come in from being outside, change your clothes, take a shower, don't track that pollen throughout your house. When you're driving, keeping your windows up, running the air conditioner. Those things can help reduce your exposure to pollen. When you're at home, keep your windows down and run the air conditioner. Again, keep the pollen outside. Make home a place where you are limiting your exposure to those high pollen counts.
Yeah, so on a day like today, if you have a convertible, it might not be the best idea to have the top down and
Sure.
looking cool out there. Can you talk a little bit about what we can do in terms of filters? I know it's usually a good time of year to change your air filters as
Right.
folks are looking at adjusting from heat to air conditioning in some
Sure.
instances. Is there any type of filter we should be looking out for that can kind of help us in that realm?
Sure. If we have central air, then there are different quality air filters we can buy. We're looking for HEPA filters. And when you go to the um, Home Depots and looking for those air filters, you'll find that there's different qualities and different levels of filtration. The higher the filtration rate, the more you'll
Hmm.
filter out that pollen. For people with window units, as you're putting them in, changing those filters, and then people can get individual room air
Purifiers.
purifiers that can help reduce the exposure to airborne particles as well.
Okay. Do those things really work? I mean, what is the science behind those in terms of helping us out? I think they can be it can be overwhelming when you're at like one of those big
Sure.
box stores looking at 20 different
Yes.
air purifiers. How do you know which
Right.
one to get?
Sure. So, a couple things. If we get, there is limited data, so there's not a lot of science there to back up how effective they are. Uh, they also come in different qualities and different levels of filtration. And then you want to look for the size of the filter and the size of the room that you're trying to
Okay.
treat. So they come in different sizes, and many of those also come with recommendations on what size room they're meant for.
Hmm.
If you put a air purifier in your den, for example, and expect it to work for the whole house, it's not going to be that useful. But if you have a small bedroom and you have an air purifier in the bedroom, you may expect better results that way.
Yeah. Okay. Now, Dr. Segal, what about air humidifiers? Are those beneficial during this particular time of year or not so much?
So air purifiers can be helpful for different reasons, but you have to be really careful with air purifiers. Higher humidity levels in the house can actually contribute to the growth of mold in the house or increased dust mite levels in the house. So it's a balancing act in terms of
Hmm.
humidity. You want to keep the humidity below 50% for sure. And again, the higher the humidity in the house, you may be creating a separate problem, which is indoor allergens as opposed to tree pollen allergens, which are outdoors.
Okay, got it, got it. So, I know typically during the dry winter months, we're looking for some of that moisture, but as we get into the
Sure.
spring and summer, the moisture is going to be more readily available. So,
Right.
certainly some interesting insight there. We've got to take a quick break, but when we come back, I want to talk a little more about what you're seeing in terms of the age group of people that are being impacted,
Sure.
and also some of the over-counter meds that we might be reaching for in order for some help. We want to keep it here on this live edition of Fox Weather Philly on this hot and somewhat humid Thursday afternoon. Hey, good Thursday afternoon. Welcome back into Fox Weather Philly. I'm meteorologist Scott Williams. Time now about 3:41, and joining us we have allergist Dr. Segal to talk a little bit about what's been bothering a lot of folks in the Delaware Valley. I know your office is getting busy with folks that are starting to see some of those signs and symptoms of just the allergies popping up. A quick question,
Sure.
Doctor, can you delineate between is it an allergy or is it just maybe a springtime cold? What's the difference?
No, that's a great question. So for people who are used to experiencing allergy symptoms, getting itchy eyes, sneezing, runny nose this time of year is going to be an expected phenomenon for them. upper respiratory infections tend to be a little bit different. Their duration tends to be 5 to 7 days, starts out of the blue. They might have other symptoms, including headache, fever, chills, GI symptoms. These are more typical of upper respiratory infection symptoms. Allergy symptoms tend to be longer in duration. They may have started for individuals this year in mid to late February. They're typical in the sense that there's a lot of itchy eyes, itchy nose, sneezing, congestion. The duration is much, much longer. So, because pollen counts stay elevated for several weeks on end, when people have these low-grade symptoms over several weeks, that's more typical of seasonal type allergies. And when symptoms get worse outside and improve coming inside, those are all indicators that this is allergy symptoms for a person.
Okay, so if you have like some watery eyes, a little tickle in your throat, when should you go and see a doctor? When should I come visit you, Dr. Segal?
Sure. So there's some great over-the-counter options that individuals can start with if they are having allergy symptoms. So there's non-drowsy antihistamines, medications like Claritin, Zyrtec, or Allegra. There are steroid nasal sprays that people can start with, medications like Flonase or Nasacort. But if those types of medications are not helpful, then it's time to talk to your doctor about some other treatment options. The role the doctor might play is making that distinction between allergy symptoms and an upper respiratory infection, or allergy symptoms and progression to a sinus infection, let's say. Also, there are other prescription medications that could be used in addition to or instead of some of those over-the-counter options. And then there's the role of the allergist. For individuals who are experiencing severe symptoms, very, very difficult to control symptoms, medications not being beneficial or helpful, an allergist can help confirm that the person has allergies, come up with a treatment plan that can include medications or immunotherapy as a long-term treatment option to help get people less allergic to those things that they're allergic to. So we're talking about allergy shots or allergy drops as a way to manage allergy symptoms long term.
Okay, Dr. Segal, tell us what would like a typical visit to your office look like? So if I come and I show up and I say, I think I'm suffering from some allergies.
Sure.
My eyes have been watery. I'm having, trouble with my throat. What would be, walk me through a scenario coming to your office, what that visit might look like.
Right. So you gave the typical type of patient that we see this time of year. So our first role as physicians is to make sure that we got the diagnosis right. And the first steps are talking with the patient, getting to know them, and getting all the information, and that's called the history. We want to find out how long this has been going on, how many years have you been experiencing these types of symptoms, what times of years do you experience these symptoms, what medications have you tried, and importantly, is it affecting your breathing? Allergies and asthma go hand in hand. For many individuals who have allergy symptoms, one of the reasons they end up seeing an allergist is because it's starting to affect their breathing. And that's where allergy symptoms could be causing asthma symptoms. So that's something we also want to pick up on and help and recognize and diagnose.
Yeah, can you talk a little more about asthma? What exactly is asthma? And
Sure.
in particular, what are some of the numbers in and around the Delaware Valley, the concentration of patients with asthma
Sure.
impacted right here in the Philadelphia area?
So asthma is the most common chronic respiratory condition. Symptoms can include coughing, wheezing, or shortness of breath, or any combination of that. In Philadelphia, I don't know the exact numbers, but in inner cities and large cities like Philadelphia, there are higher proportions of individuals who have asthma, many of whom the diagnosis is missed or hasn't been formally recognized or made. Symptoms can range from mild, depending on the individual, and the trigger and the circumstance to severe and potentially life-threatening. Asthma is a very well recognized condition, but even and a treatable condition, but even still, 5,000 people die each year from uncontrolled asthma. So it shouldn't be taken lightly.
Okay. Are there new treatment options available? What's new in terms of some of the research or some of the data just showing how to treat people with asthma and get ahead of some of the symptoms?
In the last 5 to 10 years, there have been huge inroads in terms of options for individuals with asthma. Even for those people who have had severe asthma in the past, there's many new medications and new medications on the horizon that can get those symptoms well controlled. We have new ways of managing asthma symptoms, and it's been a really exciting time in the field of allergy and immunology, which includes asthma management, helping those people and improving their quality of life.
Okay, let's talk a little bit, doctor, about I guess the pollen has begun now with the tree pollen, but really, once we're in this, we're kind of in it as we go
Yeah,
throughout spring, summer, and even into fall, because there's kind of subsequent things that we have to be concerned about in
sure.
terms of not only just the tree pollen. I mean, just take a look at some of these key times here. How are these impacting folks coming to see you right now and then throughout the season?
So everyone's different. You know, some people just have severe allergy symptoms in the springtime, and if they come to our office and we do skin testing, that can be supported with the skin tests that show they're just allergic to tree pollen. But I'll tell you that the vast majority of patients who come see us when we do those skin tests, they're allergic to a lot more than tree pollen, and their symptoms kind of support that. They'll come in saying, "Listen, I don't get a break any time of year." And that's because their skin tests are positive to tree pollen, grass pollen, molds, weed pollen. So at any given time of year, there's something out there that they're allergic to.
All right, so it's kind of like the whole gamut is just kind of impacting them. Now, you talked a little bit about, first line of defense, some of those over the counter prescriptions. Uh,
Sure,
how long does it usually take for them to become effective? And then, I
sure.
mean, there's just so many options now. I
Yes.
feel like I need an encyclopedia or like Chat GPT or something to just help,
Yeah.
explain what's the difference between the D. What does the D stand for? Is it drowsy or, I mean, decongestant? I mean, can you kind of give us a
Yeah.
crash course, if you will, on those over-the-counter meds?
Sure, you're right. It absolutely can be overwhelming when you go to the drugstore and look for something to relieve your symptoms. And there's many, many different types of medications. Some may be safer, some have more side effects. So you really have to be selective. You have to go in armed with some knowledge, and that could be a great reason to go talk to your doctor,
Mm-hmm.
or at the very least talk to the pharmacist about first line recommendations. So if we start off with medication options, uh, these symptoms are being driven by histamine. So a great first start is an antihistamine. But even when I say that, and you look at the shelf, there's all different types of antihistamines. So there are antihistamines that are older generation. We call those first generation antihistamines. Those are medications like Benadryl. Those have a worse side effect profile, and typically we try and avoid those nowadays. They cause a lot of drowsiness. There's newer medications, they're called second generation antihistamines, and examples are Claritin, Zyrtec, and Allegra. Those have a much better side effect profile. They tend to have a longer half-life, so they stay in your system longer, and they tend to work within 30 to 45 minutes. That said, if you're someone who knows you have allergy symptoms, the sooner in the season you start taking these medications on a regular basis, the better the effects might be. After we talk about antihistamines, the next step might be nasal steroid medications. These are available over the counter.
Mm-hmm.
Examples are Flonase brand nose spray, which is also fluticasone nasal spray, And that calms the inflammation at the source. So where you're having the nasal congestion, if you use a steroid nasal spray, it can calm that inflammation down. Again, using it earlier in the season and staying it on a regular basis through the season can help make it more manageable than if you expect for symptom relief after the congestion and the inflammation gets particularly bad.
Okay. All right. I mean, there's just so much to go through and, just a lot that can be impacting us, not only now, but as we progress into summer. And then it's the ragweed and the mold and everything like
Right.
that. So, Dr. Segal, tell everyone how they can reach you if they want to come in. They think they might be having some problems and the over-the-counter stuff isn't working. They want to get, some allergy shots or some allergy testing done. How can
Sure.
everyone reach you?
So we have offices in Winmore, Pennsylvania, which is just on the western suburbs of Philadelphia, and in Center City, Philadelphia, in the Rittenhouse neighborhood. Our website is philadelphia-allergy.com. We're here. We have several providers who can help get you feeling better. That's really the first step, is getting people feeling better, improving their quality of life, getting them out there doing the things that they want to do. I mean, it's a really rewarding profession to be able to help people that way.
All right. Well, we appreciate your time and expertise. Thanks as always for kind of navigating the allergy season with us. Hopefully we can have you back sometime soon. Thanks so much for joining us, Dr. Segal. And once again, it was Philadelphia-allergy.com. Is that correct?
Correct. Chestnut Hill Allergy. That's our practice name.
All right. Thanks so much, Dr. Segal. We have to take a quick break. When we come back, we'll kind of wrap everything up here on Fox Weather Philly on this hot Thursday, record-breaking Thursday afternoon.